Hi.
Hi.
My name is Fatima. I'm your nurse today. I'm going to perform and assess your head, eyes, ears, nose, throat, and your neck. Is that okay if I touch you?
Yes, it's okay.
Okay, we can start. I will inspect your head. Your head is normocephalic. It's aligned and fine. Your face is symmetrical. No facial drooping. And no lesion, no involuntary movements. Perfect. And the skin of face is appropriate to ethnicity. Now I'm going to palpate your head. Okay, it's a scalp. Is there any pain?
No.
Okay, so there is no pain, no tenderness, no lumps, no lesion. The hair's texture is fine. There is no lice and infestations. And the color is black and bright. Okay. Now I'm going to assess your eyes. The eyes are symmetrical. The eyelashes are well distributed. Eyelids are equal. There are no discharge. Can you look up for me? Okay. The conjunctiva is pink. The sclera is white. There is no discharge, no ptosis. Okay, now I'm going to assess your peripheral vision. I'm going to flick my fingers back and let me know when you see my fingers. Just
Okay.
say now, okay?
Okay. Now. 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 Now.
Okay, thank you. Your peripheral vision is intact. Now I'm going to assess your extraocular muscles. Just please look at my finger and follow my finger with your eyes without moving your head, just with your eyes, okay?
Okay.
Okay, perfect.
Thank you.
Your extraocular muscles are intact. You are able to follow my finger without moving your head, and this is true for cardinal gaze position.
Thank you.
Now I'm going to assess your pupils. I'm going to shine a light into your eyes. Okay, the pupils are equal, round, and react normal to light accommodation. I'm going to check and assess your your central vision. Please cover one eye with your hand and keep it in 15 inches across. Could you please read the last line?
D E F P O T E C.
Okay, perfect. Your central vision is 20/20. Now I'm going to check and assess your accommodation. Please, I'm going to ask you to look up the wall over there, and I'm going to ask you to look into my finger. Okay? Your accommodation is intact. Your pupils are constricted and aligned with near vision. Now I'm going to assess your ears. Your ears are equal. I see that you have two ear piercing. There is no discharge. Okay, I'm going to palpate your tragus. Is there any pain here?
No, I don't have.
No? Okay, your pinna, your mastoid. Is there any pain?
No, I don't have.
No? Okay. So I'm going to look through this otoscope with light. Because you are adult, I'm going to pull the pinna up and back. I'm looking at extra auditory canal. The extra auditory canal is pinkish in color. There is no lesion, no discharge. I'm going to look into your tympanic membrane. It's pearly gray, no redness, no blotting. See the next one. Up and back. Okay, the external auditory canal is pinkish in color, no lesion, no discharge. The tympanic membrane is pearly gray, no redness, and no blotting. Okay, perfect. Thank you. I'm going to check your hearing. I'm going to do the whisper test. I'm going to pull one of your ear and whisper one word. So please repeat after me.
Arm.
Okay. I will do with the other eye.
Pen.
Okay. So good. Now I'm doing and assess the hearing with Weber test.
Okay.
To see, I'm going to check to see if your hearing is equal in your both ears. Okay.
Okay.
When I put it in your head, please let me know if you hear equally in the sound. You will hear the buzzing sound or ringing sound.
Okay.
Please let me know if you hear equally or not.
Okay. I hear equal.
Equally?
Yeah.
Okay. So I'm going to do the and test the air conduction and bone conduction with the ring test. Please let me know when you see the buzzing sound. Just say now.
Okay. Now.
Okay.
Now.
Okay. Perfect. So the air conduction is longer than bone conduction.
Okay.
Now I'm going to assess your nose. Your nose is symmetrical. I'm going to pull a light in your nose. Can you please keep your head up? Thank you. Okay. I'm looking at nose turbinates. Nose turbinates are pink and moist. And nose septums is in the midline. There is no perforation, no discharge, no full udders, and no polyps. Okay. I'm going to check your patency of your nose. Could you please close one of your nose and sniff with the other one, like that? Could you please do with the other? Okay, perfect. So your nose patency is intact. Now I'm going to check your mouth. Your lips are pink and moist. It's symmetrical. There is no lesion and no tracks. Could you please say ah? Just say e. Okay. Your teeth are clear and white. There is no tooth decay, and the gums. Okay. The gums is pink, and there is no bleeding. Can you say ah?
Ah.
Okay. The uvula rises when you say ah.
Ah.
Okay. And the soft palate is pinkish in color. The the hard palate is whitish in color, and the tonsils are pink and are 2+. Okay. Thank you. Okay. Could you please stick your tongue and move your tongue from side to side? Okay, your tongue is pinkish in color. There are no trash or whitish color, and there is no tremors, and tongue is in midline. Yeah, perfect. Thank you. Now I'm going to check your neck. Your neck is symmetrical. There is no jugular vein destination, no lesion. The trachea is in the midline. There is no deviation, and there is no thyroid enlargement. Okay, and now I'm going to aspirate your artery. Could you please keep your breath? Okay, perfect. There is no broad sound. Now I'm going to palpate the carotid artery. Here. For left carotid artery is strong and regular in the right. And now I'm going to palpate the right carotid artery. Yeah, it's regular, in rhythm, and it's strong.
Thank you.
Now I'm going to check for any enlargement of thyroid. So I'm going to ask you please to swallow. Okay. There is no, the thyroid moves up and down when you swallow.
Okay.
Now I'm going to palpate the lymph nodes. I'm going to start with the pre-auricular. Is there any pain here?
No, I don't have.
No? Okay. Your post-auricular, occipital area, submandibular area, submental, sublingual, okay, deep cervical chain. This is the supraclavicular. Is there any pain?
No, I don't.
So there is no lymph nodes enlargement on those areas.
Thank you.